Hello, my name is Michael Wren. I'm a carer for a CLL patient, my wife Jan, who was diagnosed in 2011. CLL has been a big impact. I suppose it's underestimated that when there's someone in a family with CLL, that the ripple effect, it affects everybody in the family. It affects a husband, a wife, it also affects the children and the wider family. And I suppose how it's affected us in the world of advocacy is trying to seek information about treatments. And one positive is that making new friends internationally and learning how to navigate the CLL world. Pandemic has been a big impact, especially for someone that's immune compromised, and it also affects the whole family. In our situation, there's myself and my wife Jan, who's the CLL patient, but we also have 4 children. And when the pandemic had initially hit, 2 of our older children had to leave home, and we had to shield to try and protect Jan. The impact of the pandemic is ongoing. As the rest of the world has moved on, the CLL patients are just not on board living their lives, and the people that are very close to them are still in effect shielding, and it's still having an impact. CLL patients need access to the new treatments that they can also rejoin society, and I suppose CLL patients and immune compromised patients are the forgotten cohorts, and it's globally. We see it in many countries. The issues are not being addressed. Lifting of restrictions has impacted our family greatly. Again, the world is more risky. Patients with CLL, many of them don't have a response to the vaccine. So they're at risk the same as everybody was at risk in March 2020. And trying to navigate this world that has become more risky is become really, really difficult. I suppose where it has affected us is that we're basically still shielding. I'm self-employed, so the work I take on, I have to be very, very careful where I go. I'm still wearing my mask. Nobody's wearing masks in supermarkets and shops. And it's kind of forgotten that if people wear masks, they're actually protecting the immune compromised and they're reducing the spread of the virus. So the lifting restrictions has had a big impact. I think the voice of the CLL patients and the voice of families like ours hasn't been heard, and the issues haven't been addressed. And for us to try and navigate this world, we really need attention to this particular cohort in society that deserve to live their lives the way they lived their lives before the pandemic. They certainly didn't live it this way.